Have you ever wondered why understanding pharmacology holds such importance in anesthetic practice? It's like asking why a painter needs to understand the colors on their palette. Just as the artist masterfully blends hues to create a beautiful painting, an anesthesiologist combines knowledge of drugs and their effects to ensure a patient's safety and comfort during surgery. Pharmacology, in the realm of anesthetic practice, is the science that helps anesthesiologists paint this picture of patient care. It's about understanding how drugs work, how they interact with the body, and how the body interacts with them. It's exploring the journey of a drug, from the moment it enters the body until it is excreted, a voyage known as pharmacokinetics. It's also delving into the drug's impact on the body, its action and effects, a study called pharmacodynamics. Each patient is a unique canvas, with different health conditions, varying metabolic rates, and individual responses to drugs. Pharmacology enables anesthesiologists to tailor anesthetic plans to these individual needs, determining the right drug and the correct dosage for each patient. It's a balancing act, maintaining the delicate harmony between sedation for pain relief and the preservation of crucial body functions. Understanding pharmacology also helps anesthesiologists predict potential side effects and manage any drug interactions that could occur. It's a safety net, allowing them to anticipate and mitigate risks, ensuring that the journey through anesthesia is as smooth and as safe as possible for each patient. Pharmacology isn't just about drugs, though. It's about people. It's about understanding the patient's needs, fears, and expectations. It's about providing a sense of security to the patient and their loved ones, knowing that they are in capable and informed hands. In essence, pharmacology equips anesthesiologists with the knowledge and tools needed to ensure patient safety and comfort during surgical procedures. It's a vital part of the anesthetic practice, an indispensable brush in the anesthesiologist's palette, helping them create a masterpiece of patient care. Let's dive into the world of pharmacokinetics, an integral part of pharmacology. Pharmacokinetics is like the GPS of the drug world. Much like how a GPS guides a car on its journey, pharmacokinetics tracks a drug's journey through the body. It's a fascinating field that helps us understand what the body does to a drug from the moment it enters until it makes its exit. So, let's begin this journey by turning on our metaphorical GPS and setting off on the road of pharmacokinetics. First stop, absorption. This is the process of a drug moving from its site of administration into the bloodstream. Imagine a car leaving the garage and hitting the open road. That's absorption. The rate and extent of absorption can vary, and are influenced by factors like the drug's form, the route of administration, and the physiology of the patient. Next up, we have distribution. This is the process of the drug spreading throughout the body. Think of it like our car taking a cross-country trip, visiting various cities and towns. The drug, like our car, travels to different parts of the body. The rate of distribution depends on factors like blood flow, the drug's solubility, and the body's composition. Third on our journey is metabolism, where the drug is chemically altered in the body, usually to make it easier to eliminate. It's like our car going through a car wash, getting cleaned up and ready for the next part of the journey. The liver is the primary site for drug metabolism, although other organs can also play a part. Last but not least, we have excretion. This is the process by which the body removes the drug. It's like our car reaching the end of its journey and being parked in the garage. The kidneys are the main player in drug excretion, but other organs like the lungs and the skin can also contribute. So, to bring it all together, pharmacokinetics is the study of how a drug is absorbed, distributed, metabolized, and excreted by the body. It's a complex process with many variables, but understanding it can provide valuable insights into how drugs work and how they can be used effectively. Remember, pharmacokinetics is not just about the journey of a drug, but also about how the body interacts with the drug along the way. It's about understanding the body's responses and reactions to the drug, and how these can be influenced to achieve the desired therapeutic effect. Pharmacokinetics is an essential tool in the field of pharmacology, and a fundamental understanding of it is crucial for anyone involved in drug development, administration, or research. It's a fascinating journey, and one that continues to provide new insights and discoveries in the field of medicine. So, pharmacokinetics essentially gives us a roadmap of a drug's journey in the body from entry to exit. Now that we have a good understanding of pharmacokinetics, let's explore pharmacodynamics. Pharmacodynamics, at its core, is the study of what a drug does to the body. But it's not just about the effects. It's also about understanding how these effects are achieved. Think of it as the sequel to pharmacokinetics. After the drug has been absorbed, distributed, metabolized, and excreted, pharmacodynamics picks up the baton and focuses on the drug's performance on the body's stage. One of the key components of pharmacodynamics is drug-receptor interactions. You can think of a receptor as a lock and the drug as a key. The drug or key fits into the receptor or lock and triggers a response. These interactions can either stimulate or inhibit the body's natural functions, depending on the type of drug and the receptor it interacts with. Let's take a common scenario as an example. Imagine you're suffering from a headache. You take an over-the-counter painkiller. This drug contains keys that fit into the locks on your pain receptors. Once the drug keys turn these locks, they inhibit the receptor's ability to send pain signals to your brain. Therefore, you feel relief from your headache. Next, we have the dose-response phenomena. Simply put, this refers to the relationship between the amount of drug given and the body's response to it. Going back to our headache scenario, if a small dose of the painkiller doesn't alleviate your headache, you might take a higher dose. The increased dose elicits a stronger response, hopefully leading to complete relief from the headache. However, there are limits to this. Taking too much of the drug can lead to toxic effects, which leads us to our next point. The mechanisms of therapeutic and toxic action are another key facet of pharmacodynamics. Therapeutic action refers to the intended beneficial effect of the drug, like relieving your headache. On the flip side, toxic action refers to the harmful effects that can occur if you take too much of the drug or if it interacts negatively with something else in your body. This is why it's important to follow dosage instructions and to be aware of potential drug interactions. In our daily lives, we are often applying the principles of pharmacodynamics without even realizing it. When we take a drug to alleviate a symptom, when we increase the dose because the initial amount wasn't sufficient, or when we experience side effects from a medication, we are experiencing pharmacodynamics in action. So, to wrap things up, pharmacodynamics is all about the interaction between our bodies and drugs. It's about understanding how these interactions cause changes in our bodies, whether therapeutic or toxic. It's a fascinating field that plays a crucial role in ensuring that medications do their jobs effectively and safely. In essence, pharmacodynamics provides insights into the effects a drug has on the body and how it achieves those effects. How do these concepts apply to anesthetic practice, particularly with injected drugs? Let's dive in and explore. Pharmacokinetics and pharmacodynamics are two fundamental concepts in pharmacology. They describe how our body interacts with drugs and vice versa. When we talk about injected drugs, these principles become even more intriguing. Starting with pharmacokinetics, it's all about what the body does to the drug. Once an anesthetic is injected, it begins a fascinating journey. It's absorbed into the bloodstream, carried through the circulatory system, and distributed throughout the body. But it's not just a simple sightseeing tour. The drug's distribution is influenced by factors like blood flow to various organs, the drug's lipophilicity, or its affinity for fat, and the binding to plasma proteins. Then the drug is metabolized, primarily in the liver. This is where the body's biochemical machinery springs into action, transforming the drug into different forms, or metabolites. Some of these metabolites might be inactive, effectively ending the drug's journey. Others might be active, contributing to the drug's overall effect. Finally, the drug and its metabolites are excreted, mainly via the kidneys. This is the body's way of tidying up, removing these foreign substances to restore balance. Now let's turn our attention to pharmacodynamics, or what the drug does to the body. Injected anesthetics interact with receptors in the nervous system. These sites are like locks, and the drug molecules are the keys. When the key fits the lock, it triggers a series of events leading to the desired therapeutic effect. Different anesthetics have different keys, and thus they interact with different locks or receptors. Some anesthetics, like propofol, work by enhancing the activity of GABA, a neurotransmitter that inhibits neuronal activity. This results in sedation and loss of consciousness. Others, like ketamine, block the NMDA receptor, another neurotransmitter system, leading to a different type of anesthesia. It's important to note that the response to a drug is not a simple on-off switch. It's more like a dimmer dial, with the intensity of the response depending on the drug concentration at the receptor sites. This relationship is often represented by a dose-response curve, illustrating how changes in the drug dose affect the body's response. So, understanding these principles allows anesthesiologists to predict and control the effects of injected drugs. They can estimate how quickly a drug will take effect, how long it will last, and how it will be eliminated from the body. They can also anticipate potential side effects and interactions with other drugs. This knowledge is critical in ensuring the safe and effective use of anesthetics in practice. It's like being a master conductor, orchestrating a symphony of biochemical interactions to achieve the perfect balance between the desired anesthetic effect and minimal side effects. And that, my friends, is the art and science of anesthetic practice. What about inhaled drugs? How do pharmacokinetics and pharmacodynamics apply in this case? Well, let's delve into it. Inhaled drugs, like those used in anesthesia or for respiratory conditions, have their own unique journey in the body. Let's consider pharmacokinetics first, which is how the body handles a drug. The journey starts with absorption. Inhaled drugs are absorbed rapidly through the large surface area of the lungs. As these gases or aerosols pass from the alveoli into the bloodstream, they spread throughout the body, a process called distribution. The speed of this distribution depends on several factors, including the drug's solubility in blood and tissues, and the blood flow to various organs. Next comes metabolism, the process of breaking down the drug. Inhaled drugs are unique in that they're mostly excreted unchanged, skipping the usual liver metabolism. This is because their molecular structures are generally resistant to enzymatic breakdown. However, a smaller fraction may still undergo some metabolic alteration in the lungs or at other sites. Finally, we have excretion. For inhaled drugs, this is primarily via the lungs, in the same route they came in. The rate of elimination depends largely on the depth and rate of breathing. Now, let's shift gears to pharmacodynamics, which is all about what the drug does to the body. Inhaled drugs interact with specific receptors to produce their effects. For instance, inhaled anesthetics work by interacting with receptors in the central nervous system, leading to a decreased response to the surrounding stimuli, which is the state of anesthesia. Inhaled bronchodilators, on the other hand, act on receptors in the airways, leading to dilation and easier breathing for people with conditions like asthma. The extent and type of effect depend on the drug's affinity for the receptor and the number of receptors it binds to. It's important to note that the effects of inhaled drugs can be quite immediate due to their fast absorption and onset of action. The effects also typically cease quickly once administration stops, as the drug is rapidly exhaled. This rapid start and stop action is another unique feature of inhaled drugs. So, in a nutshell, the pharmacokinetics and pharmacodynamics of inhaled drugs offer a fascinating blend of quick onset, target-specific action, and rapid cessation of effects. These qualities make inhaled drugs a valuable tool in various medical fields, particularly in anesthesiology and respiratory medicine. Thus, a deep understanding of these concepts enables anesthesiologists to effectively use inhaled drugs in their practice. Knowledge of how these drugs move through and act in the body allows for precise control over their effects, ultimately enhancing patient care. We've covered a lot of ground today, so let's summarize the key points. The realm of pharmacology and anesthetic practice is vast and incredibly important. It's the foundation for safe and effective treatment during surgical procedures. We've delved into the concepts of pharmacokinetics and pharmacodynamics, understanding how drugs move through the body, their effects, and how these principles apply to both injected and inhaled drugs. Remember, the pharmacokinetics of a drug deals with how it is absorbed, distributed, metabolized, and eventually excreted from the body. On the other hand, pharmacodynamics explores the biochemical and physiological effects of drugs and their mechanisms of action. The application of these principles in anesthetic practice allows for a nuanced understanding of how injected and inhaled drugs work, leading to better patient outcomes. Remember, pharmacology is an essential tool in anesthetic practice, helping to ensure the safe and effective use of drugs during surgical procedures.